At SASH, Lisa is examining Angus. The 5-year-old has swallowed a soft toy, and Lisa is worried that it could be lodged in his esophagus.
He actually looks pretty normal, and that's because his owners have really been on the ball and brought him in as soon as they noticed that there was anything wrong, which means that at the moment it's probably not causing an obstruction, but with time it's got the potential to become quite stuck. What I recommend we do now is take an X-ray of Angus's chest, because I want to have a look at his esophagus and make sure that that toy is not sitting in there, because if it is, then we're going to have to pull it out with an endoscopy. But if it's not in the esophagus and it's moved already into his stomach, then we really have 3 options. Now, the first one is to make him vomit, and hopefully he'll bring it up the way that it went down. Option 2 would be to perform an endoscopy and try and pull the toy out that way. And the third option would be doing nothing and waiting and seeing if he passes it. But it could get stuck. And if it gets stuck and causes an obstruction, then that can be life-threatening. You know, it could perforate through his bowel, and that can cause peritonitis. That's potentially fatal, would need emergency surgery. It's one of those things that I just can't guarantee which way it's going to go. So those are the options, and you guys are going to have to decide what you want to do.
Whatever you suggest, whatever you think is the best option.
Yeah.
Because it's not worth the risk to wait, I don't think.
Yeah.
Angus's future now depends on the results of X-rays and just where the toy has ended up.
Hopefully we'll get some information from it, and then I'm going to try and make him vomit if the X-ray is normal, and then fingers crossed that I get another one of these out.
It's brown in colour if that's of any help.
Good to know. Won't be long. Come on, Angus, this way, buddy. Let's go. Angus has been through so much with his epilepsy and his seizures, and they've all been in and out of hospital, and now he's here again with a toy stuck that could be life-threatening. We need to get this toy out very quickly for Angus's sake and for theirs. The X-ray showed that the soft toy is unlikely to be in his esophagus, so it's more likely that it's in his stomach. What we're going to do now is we're going to try and make Angus vomit so that the fluffy toy comes out in the easiest way possible. Now, I need to feed him a big meal so that he's got something to coat that toy when he vomits it up. This is as spoiled as they come.
Are you excited?
There you go, Angus. That is delicious.
Angus will now get a shot of apomorphine to make him vomit.
Hey, bud, you're going to feel a bit sick now, and I'm really sorry about that. Here comes the drooling.
There we go. This is what happens when you eat your toys. All right. You get to be sick.
I'm really hoping that Angus vomits up this fluffy toy, because if he doesn't, we're going to have to give him an anaesthetic and perform an endoscopy to try and pull it out. He's really not feeling well. Good boy. Come on. Good on, buddy. Oh, I'm a bit worried now, because that's a lot of food, and there's no toy in there. Angus has vomited a couple of times, and as I'm searching through this stinky vomit, there is no sign of pet, which means that Angus has to have an anaesthetic so that we can try and pull out the toy with an endoscopy. Hey, I'm so sorry. Hey, bud, we gotta get that toy out.
Dr. Vibeke Russell has the tricky job of trying to remove the soft toy in Angus's stomach.
Hey, bud, you're gonna be all right. We're gonna get this out of you, hey? We're just anaesthetising Angus now. We're gonna put a camera down his esophagus, his food pipe, to try and see if that toy is in his stomach, and hopefully we'll be able to grab it out and pull it out his mouth, because if we can't get it out and it's in there, he's gonna have to have surgery.
So we're going down into the stomach now. It's not looking hopeful. I don't see...
I mean, it would be pretty obvious if it was in there.
Yeah, this is a fairly small ball of food, and I don't see any soft toy there, which is disappointing.
Come on, Angus. It's not a tiny toy. It shouldn't be this difficult. Really.
The frustration is building as the minutes tick by and there is no sign of the stuffed toy.
At the moment, things are looking a little bit worrying, and I don't even know if the toy's in there.
After more than 25 minutes, Lisa and the team are almost ready to give up and take Angus to surgery.
We're looking around and we're really not having any luck finding the toy. We're finding bits of food, bits of hairs. It's all just a big chaotic mess in that stomach.
Oh, what's that?
Oh, what is that? Looks a bit non-food-like.
Doesn't non-food like?
I wonder if that is the tag. I think you got it, babe.
Well, it's just, so we just have to go very slowly.
Come on, please be there. That looks like a toy.
Yep.
Yeah. Oh. Maybe those sardines weren't such a good idea, Mark. Oh, that's a job well done, I think. That is a huge relief. We managed to get the fluffy toy out of Angus's stomach with the endoscopy, which means no surgery for Angus. And after a little bit of recovery time, he'll be home ready to take his medication. Hey, buddy. Angus, do you want to go home? You're all ready to go home. Come on, buddy.
Later that afternoon at Sash, sheepish toy eater Angus is ready to go home.
Hey, you can't live without your friend. The procedure's gone really well. Angus has recovered and now his family are here to pick him up and take Angus and Pet home in time for dinner and Angus's medication. Come on, buddy, let's go. Come on.
Relieved owners Tracy and Ray are waiting in reception.
We are looking forward to getting him home, and just wait for the next episode of what he gets up to.
Come on, Angus. What's around the corner? Hey,
Yeah, we're over here.
Angus there.
Hello. Hello.
I'm really glad that Angus is okay. He's a pretty special dog. Like, they've saved his life once here before, and pretty sure they've done it again this time.
All right, so here is your other pet. He's been shampooed, blow-dried a little bit, had the deluxe treatment. So I've spoken to Angus and told him that he needs to be nice to his pet.
To his pet.
So the rest is up to you guys. I've done my vet counselling and
Angus,
you have to mend this relationship.
what did you do with this?
We'll take Angus home now, give him a strong talking to, tell him that friends are not food, and then we'll give him his drugs and cheese, and hopefully everything will be fine.
Okay, thanks again, Lisa.
My pleasure. Take care. Bye, Angus.
You gonna
Bye,
say bye?
Pet.
Come on, home time. Good boy.
See the vet in a minute, okay? Yeah. Poor little thing. Aren't you, eh? You're a wounded little soldier, aren't you?
At the Bondi Referral Hospital Sash, David and Margaret's 3-year-old Cocker Spaniel Daisy is in severe pain.
We gave her a treat this morning and I noticed that she was neither taking it in or spitting it out. I tried to open her mouth to see if anything was any problem there, and she has just screamed. She's yelped in real pain. She's got a gooey eye at the moment as well, and we've only noticed that this morning, so I don't know whether those two are in any way connected, but she's in a lot of discomfort.
So what's been happening? What's going on?
We thought we had something stuck in her mouth, but we tried to open her mouth and she yelped terrible pain, and her eyes are a bit gooey.
Emergency vet Dr. Lisa Chimes checks for any telltale signs of what's causing such intense pain.
Now you're gonna let me open your mouth and see? Oh, she doesn't even want me going near the mouth, does she? Oh, puppy girl. You wanna let us do this? Sweetie. Daisy is really in a lot of pain. Her left eye is bulging forward and her jaw is so sore that she won't even let me touch her mouth.
Let me have a go. Yeah, let me put it. No, all right, Daisy.
The eye doesn't actually look abnormal. It's more the tissue surrounding the eye that doesn't look right. Something's causing it to pop forward. When there's inflammation in that eye area and you open the jaw, it puts pressure onto that sore spot, and that's quite a classic finding that we see with animals that have got problems behind their eye. They're painful when you open their mouths as well.
Poor little thing.
We could be looking at something like an abscess. It could be something's stuck up there. Worst case scenario, it could be a tumour. Look, she's a young girl and I think that's much less likely, but we do have to rule that out.
Oh, you poor thing. Eh?
I don't like seeing her like this at all, and
Yeah.
What I think we should be doing is a CT scan. She'll have to have an anaesthetic for that, but that allows us to see the whole skull and all the soft tissues and everything around the eye, and hopefully we'll see what's going on there. The fact that it's come on so quickly and she's so sore, we have to do something.
Let's do it. Let's get it.
Okay.
Get it done.
All right, Missy. Good girl.
At SASH, Lisa is about to give Daisy a CT scan to find out what's causing the painful swelling around her eye and jaw.
Hey, Chris.
Hey.
Got her here.
Hey, Daisy. Hello.
All right, so we're ready to CT her head?
Yep.
Yep, okay, fantastic.
Daisy has to be anaesthetised for the scan.
You're such a good girl. Your eye's sore, honey. It's so swollen. All right, Days, let's do the tube. Oh, that mouth is sore, so even under anaesthetic. If she's in pain under anaesthetic, you've got to imagine how much pain she's actually in when she's awake. We've really got to get to the bottom of this for this poor little girl. All right, so I'm just looking at the CT now, and what we are looking at is a slice through Daisy's head. This side is supposed to look like that side, and you can see how much more tissue and swelling there is behind that left eye, and that's where Daisy's pain is coming from. I can see that there's no obvious tumour, there's no obvious abscess. I can't find any foreign material or something stuck behind the eye. Most likely, I'm thinking something like cellulitis.
Cellulitis is an aggressive bacterial infection that can spread rapidly.
I do want confirmation from our radiologist, so I'm going to send the images to them. But in the meantime, I think it's best that we start treatment quickly, because if we delay it any longer, that infection is going to continue to spread. That's life-threatening. So I'm just checking to see if Daisy's CT report has come back, and here it is.
Lisa suspected these were symptoms of an acute infection called cellulitis and started Daisy on an immediate course of antibiotics.
The report from the radiologist is actually really good news. It means that our initial suspicions were right. Daisy's on the correct treatment, and we just need to continue on and we'll get her back home. Hi, Daisy. Hi. I know. You're looking good and very happy. My goodness, that's so much better. That is so much better. Hey, it's gone right down. It has. Can I get you out? You want to come out with me? That's a girl. Good girl. Let's have a look. Can I have a look at you? Wow. Yeah, that's great. Daisy is so much brighter compared to how she was when she arrived. She's friendly and wagging her tail. This is a really good sign. So much better. Yeah, you're looking great. Daisy, hi.
It's been 3 days since Daisy was first treated for cellulitis, and it's now time to go home.
Can I get this on? You gotta wait. You gotta wait. Hey, I know. Daisy, wait. Daisy is clearly feeling much better. I can't even hold her still. Are you ready to go? Yes. Yes, I am. Yes, I am. The swelling's gone right down. She's comfortable. She's happy. I think she wants to go home. Okay. Let's go. Let's go. Let's go. Come on, let's go. Yeah. You won't believe who's around that corner. I think you know. Oh, God, look at her.
You're like a new doll.
Oh, Daisy.
Let's have a look. You couldn't open your mouth last time we saw you, could you? Hey?
See?
What a good girl.
Looked after you here.
Yeah, have they ever given you a wash in the bath?
Oh, it's such a relief that it's cellulitis and it's nothing worse, and we can take her home and it's wonderful. So it's a very good outcome from a very dismal looking situation to start with.
Daisy, see you later. She doesn't even want to look at me. She's out of here.
Thanks very much.
Thanks for the appreciation, Daisy.
Thank you.
See you later. Bye.